Okay, so we are going to do a case discussion. So for this first case, I have chosen a very uncomplicated, very simple case and relatively straightforward. But I'm going to break it down and explain how to go about with this MCQ and hopefully subsequently with other cases that I'm going to upload, I'm going to up the difficulty level and present more kind of complicated cases that have a lot of equations and a lot of symptoms coming in and are a bit more confusing. But let's start with this one first. A 65-year-old man presents with a 3-month history of the passage of blood and mucus mixed in with his feces. He has never had these symptoms before. Which one of the following conditions is the most likely diagnosis? So we have these options. There's ulcerative colitis, ischemic colitis, diverticular disease of the sigmoid colon, carcinoma of the colon, and internal hemorrhoids. Starting with the first option A, ulcerative colitis. Now, ulcerative colitis is one of the two most common forms of inflammatory bowel disease, the second one being Crohn's disease. Now, ulcerative colitis presents in younger patients, in patients less than 30 years of age. So, the initial presentation of the disease is usually in people who are between 15 to 25 years of age, less than 30 years of age, let's say, and here our patient is 65 years of age, right? So, although the presentation of blood and mucus mixed in with his feces is very common with ulcerative colitis, but just because the age bracket does not sit, so it's very uncommon and it's very unusual that de novo presentation of ulcerative colitis in this age group, it's very unusual. So, that's why we rule this out. Option B is ischemic colitis. Now, a very important accompanying symptom of ischemic colitis is abdominal pain or abdominal cramping or at least some form of abdominal discomfort. Patients typically present with acute onset of crampy abdominal pain and usually pass blood mixed stool within 24 hours of presentation, because we know that ischemia will rapidly lead from inflammation, acute inflammation, to necrosis, and wherever there is ischemia, unless it is reversed, the symptoms are going to be fulminant and it's going to be devastating, and pain is always going to be there. So because the patient does not complain of any pain in this situation, then we can easily rule out ischemic colitis. It's obviously not ischemic colitis. Option C has diverticular disease of the sigmoid colon. Now, the characteristic bleeding associated with diverticular disease is the sudden passage of a large amount of blood, and it does not necessarily have to be accompanied by fecal material. So, this also is ruled out. Simply because of this, diverticular disease will not have this presentation, with blood and mucus mixed with the feces, because it's just diverticulum, an outpouching of the mucosa of the sigmoid colon. And there is no explanation why. So if it's going to rupture, if there's going to be even inflammation, diverticulitis, or rupture of an inflamed diverticulum, there's going to be fresh blood that's going to come out. There's not going to be any blood mixed with stool. E. Internal hemorrhoids. Now, hemorrhoids, they most often present with anorectal bleeding, but the bleeding tends to be on rather than in the feces. And this question says that the blood and mucus, they are mixed in with his feces. So that's a very important cue, because with hemorrhoids, the blood, it does not mix with the feces, it just sits on the feces, right? So that's a cue that's just a giveaway that it cannot be hemorrhoids. So the answer is D, carcinoma of the colon. Why is it carcinoma of the colon? The most important thing that I want you to remember is that it is the most common cause of blood and mucus in the stool. Carcinoma of the distal bowel or of the colon, it is literally the most important and the most common cause of blood and mucus in the stool. And now, colon cancer, it can present in 3 different ways. One is that there'll be vague abdominal symptoms with or without pallor, depending on how much blood loss has been there, leading to anemia. Second, it'll be completely asymptomatic, which is actually really, really common for the patient to be asymptomatic, and that the cancer has been discovered by routine screening. And third, as an emergency condition, because the tumor has grown up to a size where it's obstructing the intestine and the passage of feces and leading to acute abdomen, or peritonitis, or very rarely acute gastrointestinal bleeding. So this was it, a really small, a very simple, straightforward, easy kind of a case, because this was the first, so I thought we'll keep it like that and we can progressively increase the difficulty level. And you can give me your feedback, you can give me the kind of cases you want to be discussing, or the different systems that you want to focus on, or is there any particular MCQ topic that you want to be kind of discussing, and we can do that in the comment section as well. So you're very welcome to do that, and thanks for watching.